Hi there, future RNs. Today, let's talk about beta blockers. It's easy to recognize these medicines as they have the lol ending to their names, like metoprolol, carvedilol, atenolol, nebivolol, and propanolol. Clinically, they are used to treat hypertension, arrhythmias, chronic heart failure, and relieve symptoms of stable angina as beta blockers reduce the workload of the heart. Next, let's see the side effects and adverse reactions of beta blockers. First is bradycardia. This medication suppresses the activity of the SA and AV nodes. So as a nurse, teach your clients how to check their pulse before taking a beta blocker at home. Advise them not to take it when the pulse is below 60 beats per minute and to inform their healthcare provider. It is also contraindicated for clients with heart block as it can lead to cardiac arrest. Next is bronchospasm. Beta blockers are contraindicated with clients who has asthma or experiencing shortness of breath and or wheezing. Beta blockers can also mask the symptoms of hypoglycemia as diabetic clients taking beta blockers do not experience tachycardia when hypoglycemic. Teach your clients with diabetes to monitor their blood glucose levels closely when taking a beta blocker. Fourth is hypotension. As the medicine decreases the cardiac output, this is a common side effect among antihypertensive medications. Lastly, teach your clients not to stop the medicine abruptly, as it can cause rebound hypertension and angina. Alright, now I have two questions for you on beta blockers. A patient is admitted with dysrhythmia, and the physician prescribes propanolol. Which statement by the patient requires the nurse to hold the ordered dose and notify the physician for further orders? 1. I use an inhaler at home for asthma. 2. My heart feels like it is racing and I feel very weak. 3. I had caffeine this morning with breakfast. And 4. I smoke 2 packs of cigarettes per day. The answer is 1. Remember that beta blockers are contraindicated in patients who has asthma. Next, the nurse is preparing to administer nebivolol to a client diagnosed with essential hypertension. Which intervention should the nurse implement prior to administering nebivolol? Select all that apply. 1. Assess the radial pulse. 2. Take the client's blood pressure. 3. Have the unlicensed assistive personnel obtain a full set of vital signs. 4. Ask the client if he or she is experiencing cough. 5. Check the client's apical heart rate. The answer is 2 and 5. Let's go over the options one by one. When the nurse is the one administering the medicine, it is better to assess the client's apical heart rate instead of the radial pulse. So number 1 is not included. 2 is included because beta blockers reduces the heart rate and the blood pressure. So it is important for you to check both before giving the medicine. 3. The UAP can take routine vital signs, but as the nurse administering the medicine, checking of the blood pressure and apical heart rate includes assessment and evaluation that cannot be delegated to the UAP, as well as temperature and respiratory rate are not needed before giving a beta blocker. 4. A cough is a side effect of ACE inhibitors, not beta blockers. Lastly, 5 is correct because again, the apical heart rate is required for the nurse to safely administer any beta blocker medication. So now we're done on beta blockers. Let me know in the comments what topic you want me to do next. Thank you everyone and have a great day.